This morning, the session title is Is a Program Ready for Replication and Rigorous Evaluation? That's probably a question that I've gotten so often over the years, and it really doesn't matter if it's a new agent or new specialist, all the way to very seasoned agents. How do you know when to evaluate? Big question. We all know that if you evaluate at the wrong time, well, your results aren't going to be too good. But bigger than that is that it's such a waste of time, and this day and time is everything. And so this is a very important subject, and I'm so glad to welcome this morning our session presenters, Laura Downey and Dr. Donna Peterson. They're both doctors, actually. Sorry, Laura. And they're also both associate extension professors and evaluation specialists joining us from Mississippi State University this morning. They have experience developing and evaluating a range of extension programs. Recently, they used the NSSA method to conduct a national environmental scan, which is what we talked about yesterday, and a valuability assessment, that's easy for me to say, of 4-H healthy living programs. Drs. Downey and Peterson are members of the program and staff development team at Mississippi State University, and I want to welcome them, and good morning. We're glad you're here.
Good morning.
Thank you.
Dr. Donna Peterson, I'd like to welcome y'all to this presentation, When is a Program Ready for Replication and Rigorous Evaluation? As Karen said, we get that question all the time as evaluation specialists. There's a specialist or an agent that think they have something worth telling others about, and oftentimes they do, but they haven't necessarily invested the time and effort in enough evaluation yet to disseminate it to others. So we hope through today's presentation we can share our experience of using the systematic screening and assessment method as a way to really assess whether your program or programs in your state are ready for other specialists or agents to implement.
So increasingly, extension professionals are attempting to implement evidence-based practices. The problem, however, is that in certain areas, programs with evidence of impact are limited. Additionally, programs are continually being developed by extension with the intention of finding feasible and effective approaches to achieving desired outcomes. Extension programs that have evidence of meeting those intended outcomes using appropriate evaluation techniques should be considered for dissemination, replication, and more thorough evaluation. So the systematic screening and assessment method, or we're going to call it the SSA method, can help extension professionals identify those programs that may be ready for more rigorous evaluation and replication. So in today's session, we'll go through a little overview. We're going to talk about an introduction to the method. We will describe the 6 steps that are part of the SSA method. We will describe an application of the SSA method, the limitations of SSA, and then we'll also have some time for you to assess one of your own programs for possible replication and more rigorous evaluation.
So the first thing that I'd like to say is that the SSA encompasses 2 evaluation approaches that you might be fairly familiar with. The first one is an environmental scan plus an evaluability assessment. And when you put those 2 together, that's when you get the systematic screening and assessment method. And the SSA extends the traditional approach to environmental scanning by taking it one step further and including that evaluability assessment that really helps you identify what programs are most promising, meaning which programs seem to be effective at achieving their intended outcomes, and those programs that are effective are then considered for replication or further evaluation. But at the most basic level, just keep in mind that the systematic screening and assessment method is a combination of these 2 other methods that we commonly use in evaluation. So let's talk first about environmental scan. So I know y'all had a whole presentation on this yesterday, but just in case somebody wasn't with y'all at that presentation, I wanted to spend a few minutes talking about this. Environmental scans have been used in the business world for decades as a way for decision makers to glean information and data about the status of a topic or issue in the organization. So scans are conducted to provide decision makers with a gleaning of information about that topic of interest to them. Extension similarly is using that approach to systematically identify what programs exist or where there's gaps, meaning there's not a program existing on a given topic or focus area. So environmental scans are designed to help decision makers, whether that's specialists or administrators or even agents, be able to make decisions about future program planning, implementation, or adaptation. Scans provide evidence about the existence or lack of existence of programs that meet the need of a target audience. You can think about an environmental scan as an internal assessment of the programmatic landscape of extension. The second core element in SSA is evaluability assessment, and this component determines whether an evaluation or a more rigorous evaluation should be conducted on programs that are identified through that first phase, the environmental scan. So if a program is surfaced through the scan, it would then go through this phase to really determine whether the evidence is there, given likely benefits, consequences, and cost for this program to be replicated or more rigorously evaluated. Beyond deciding whether a program should be evaluated through this assessment, it also helps clarify program intent. This method can help you clarify the program reality and the soundness of the program, as well as it can help you there's something that's not coming to, identify opportunities for change to improve the program. It also can indicate how results can be used in the future. So it doesn't just tell you whether it should be evaluated. There's other steps that it can help you complete by conducting an evaluability assessment. So like I said, when you put these two together, you then get the systematic screening and assessment method. This is a cost-effective and rapid approach to identifying existing programs with evidence of achieving intended outcomes. And we've used that statement before in this presentation, evidence of achieving intended outcomes. So I just wanted to give you an example of what that would mean before we go forward. So first of all, I want you to think about a hypothetical program such as a diabetes prevention program. It could be that the evidence of achieving intended outcomes is an increase in knowledge about healthy eating, or it could be a decrease in unhealthy behaviors. If you had a program targeting diabetes prevention and you saw these outcomes being achieved, then you might say, I might want to kick it up a notch and evaluate this in a more rigorous way, or I might want to share it with a colleague and see if they would replicate it and get the same results. So that's what we mean by a program achieving the intended outcomes, or having evidence that it's achieving the intended outcomes. And we're hoping that this evidence has at least been documented through a pre-post study design at a minimum. We're going to talk about the levels of evidence in coming slides, but for just background information, at least think about a pre-post study design being used to document that evidence. So now we'd like for you to think about an extension program in your state that has some evidence that it's achieving its intended outcomes. And we've talked about what that means, achieving its intended outcomes. One thing I also want to talk about is, what is a program? So as we ask this question, think about the program in your state with a program meeting this criteria. It addresses the needs of a target audience that extension serves. The second criteria of a program is that it has educational lessons that build on and reinforce each other, that those educational lessons are intended to lead to a series of outcomes, meaning from knowledge to behaviors to condition change. So that's the third criteria. And then the fourth criteria is that there is, in fact, evaluation going on. There is, in fact, ongoing monitoring and evaluation of that program. So now I'll ask that you go into your Q&A box in Zoom and tell us the name of that program that you have in mind in this session today. We'll give you a minute to think about that and to type in your response.
This is the audience participation part. So everyone, find that Zoom box on your device and start entering your program name so that you will be represented and heard. Okay, one of the first ones coming in is from Missouri, is donor education program. Another one, Strong Women. Julie contributed her program, Building Positive Communities. New Employee Onboarding from Arkansas. Co-parenting program. Lots of things coming in.
Mm-hmm.
Work readiness training for paraprofessionals. The Western Region 4-H Volunteer E-Forum achieved its goals and more. And lots of folks talking. CalFresh, Plan, Shop, Save, and Cook. Real Money, Real World Financial Literacy for Youth. A lot of different kinds of programs that folks are collecting evidence of and being able to evaluate.
Great. Well, I'm so glad that y'all took time to input the program that you had in mind. We're going to ask that you keep that specific program in mind as we go through the remainder of the session, because at the end of the session, we're going to walk through an exercise that will help you actually assess the evaluability of that specific program. So keep the ideas coming in, but we're going to move ahead for sake of time, but keep these programs in mind going forward.
Okay, so now we're going to talk a little bit about the steps in SSA. So according to Leviton and Gutman, SSA is a sequential approach that includes the following 6 steps. The first step is selecting a topic. The second is scanning for programs that relate to the topic. The third is screening the programs identified using predetermined criteria. The fourth is conducting an evaluability assessment of those programs that pass the initial screen. The fifth is to review and rate interventions for promise or readiness for evaluation. And then the final step is that application step. So applying the information to help inform program evaluation. So to provide an example of an application of the SSA method, we're going to describe a collaboration among National 4-H Council, 4-H National Headquarters, USDA, and those of us here at Mississippi State University Extension that we did to identify programs that adhered to the National 4-H Healthy Living Mission and Logic models, which you can see there on the screen. And we wanted to see if they were going to be ready for comprehensive outcome evaluation and/or replication at a national level. So in order to do this, we conducted an environmental scan and an evaluability assessment of 4-H healthy living programs in the 5 domains that included healthy eating, physical activity, alcohol, tobacco, and other drug prevention, social emotional health, and injury prevention. Okay, so again, the first step in SSA is to select a topic. So for us to identify those programs that adhered to the 4-H Healthy Living Mission and Logic models that would then be included in our final environmental scan database, we used the criteria listed on this slide. The first one was to target 4-H youth ages 9 to 19. We wanted to see a youth development program with an organized, purposeful set of activities designed to achieve positive youth development outcomes. We wanted to see activities that were congruent with the 4-H Healthy Living mission. And we wanted the programs to be developed and implemented by cooperative extension faculty and staff. So the second step in the SSA method is again to scan for programs related to the topic. So in our environmental scan, we used 3 methods. The first was a survey. We conducted an electronic survey using Qualtrics that we administered to members of the state 4-H program leaders and the 4-H Healthy Living Liaison listservs. We had several questions that we asked participants to report on, and they could report on up to 15 programs. A second method that we used was structured interviews. So those of us at Mississippi State followed up with the state 4-H program leaders who either did not submit any programs through the survey to see if they had any that they did want to submit. And we also followed up when we needed additional clarification. Maybe something wasn't clear in how they responded, or we just wanted to know a little bit more about the program. Then our third method was document reviews or content analysis of some grantee reports from the 4-H Healthy Living projects that were funded by Walmart, United Healthcare, and Coca-Cola. And we also reviewed the 4-H Healthy Living literature review that was done back in 2009 by Hill, McGuire, Parker, and Sage. So step 3 of the SSA method, again, is screening programs identified using predetermined criteria. So the goal of the evaluability assessment was to identify programs, again, we're going to repeat this over and over, identify programs that were ready for comprehensive outcome evaluation and/or replication at a national level. So we reviewed all the material that was submitted through the environmental scan through those 3 different methods to determine which programs most clearly aligned with the respective 4-H Healthy Living logic models. So only those programs that met the criteria on this screen moved to the evaluability assessment of the project. So again, those criteria were goals, objectives, activities, and outcomes are realistic, measurable, and logical. The outcomes are tied to 4-H Healthy Living logic models. The outcomes were assessed with at least a pre-test, post-test, and there were actually evaluation results that had been reported, rather than just having an evaluation in progress. We actually wanted to see that some results had been obtained.
So step 4 in this method is to conduct the evaluability assessment of programs that pass that initial screening that Donna just spoke of. And so once they met the criteria that was presented on the previous slide, we actually included them in the evaluability assessment. And we used a checklist to actually conduct the evaluability assessment. And that checklist was developed out of a checklist that was provided by the United Nations Development Fund for Women. And they had identified 3 primary areas to look at when completing an evaluability assessment. The first one is program design. The second one is availability of information. And the third one is conduciveness of the context to actually carry out that evaluation. And so when we looked at the information that was provided by a participant, we looked at the program design first. And by that, 2 indicators that we used was that it defines a problem that it aims to change, and that they could clearly articulate what that problem was, that we knew exactly what target they were shooting for through this program. Second, that it had a clear theory and logic model. We actually asked participants in certain cases to provide their logic model so that we could see whether the theory behind the program was in place. There were other indicators we looked at program design, but these are just 2 to present now. The second overarching content area was availability of information. So they really had to be able to document that they had the capacity to provide data for evaluation. Not just that they would in the future have that data, but they actually do have that data for us to look at their findings, not necessarily the hard data itself, but we could see their findings as an indicator that they had the capacity for evaluation. The second one was that they had a monitoring system. And we don't mean a complex monitoring system, but just any way that they were going to actually be able to capture that data that they needed to actually carry out their evaluation. And then the third main construct that we were looking for was conduciveness of the context. And that really was, were the resources available within the institution, within the state or location where this project was being carried out to actually carry out the evaluation. And resources could be human resources as well as financial resources. Evaluation isn't cheap, and so especially rigorous evaluation isn't cheap. And so we just were looking at it and saying, okay, could they actually carry out the evaluation as it was intended, given the context? We could glean most of this information from the data provided in the environmental scan. At some times, though, we actually had to follow up with the participants and ask for more information regarding one or more of these three overarching indicators. We did that via email, we did that via telephone, and once they gave us that information, we could then continue the evaluability assessment of the information provided. So now let's talk about step 5 in the systematic screening and assessment method. And this one is where you review and rate the readiness of the program based on the evaluation data provided. And so programs that met the criteria for inclusion in the evaluability assessment were classified as either having preliminary, moderate, or strong evidence of replicability. And we did not come up with the definition of preliminary evidence, moderate evidence, or strong evidence. We pulled heavily from the Corporation for National and Community Service that had already done some work documenting what types of study designs were needed for preliminary evidence, what type of study designs were needed for moderate, and what kind of study designs were needed for strong. And so as you can see on your screen, we really thought of study designs as a continuum, with them being from here on the slide, from the weakest at the bottom up to the strongest. Those that had post-study designs were considered to have the preliminary evidence. Those that used experimental, quasi-experimental, or a correlational study design, whether that was a few designs, so it didn't have to be many, but at least a few, were determined to have moderate evidence. And then those programs that actually carried out an experimental or quasi-experimental design in multiple sites were considered to have strong evidence of replicability. Those programs, even if they were collecting evaluation data, if they at least didn't have a pre-post study design, they were excluded from this step. They didn't progress going forward. We'll say that after much discussion about what to do with retrospective pre-test, post-test study designs, we actually left those in as preliminary evidence. But if simply an observation was used or an end-of-session survey, it didn't advance to the next stage. Okay, so let's talk about step 6, apply. This is where you apply the information to actually inform program evaluation. And so what we have done through the information provided as a result of the environmental scan and the evaluability is to actually try to provide professional development workshops regarding the deficits that we observed in the programs that were submitted. So we consistently saw that there were weaknesses, oftentimes in the theory or the logic chain behind the information provided. So we've offered some workshops and we'll continue to offer some workshops regarding that. We also have given some thought to 4-H signature programs based on what we found. And certainly our national partners, those outside of Mississippi State, are given thought to this. What indicates a signature 4-H program? That's bigger than Dr. Peterson and myself, but that's a part of applying the information. Certainly technical assistance on evaluation, coming alongside those states that are almost there but not quite there and trying to help them come to the next level with evaluability. And then certainly recommending a standardized approach to evaluation, meaning that Donna and I actually have identified the REAIM framework, and I think Donna will talk about that more in a minute. So I'll go ahead and talk about it. Great, thank you. Was that we use a standardized evaluation framework across 4-H Healthy Living programs, hoping to gain the same type of evidence from program to program to program to actually determine which ones are the best programs out there. And we settled on the REAIM evaluation framework, which has 5 phases to evaluation, and it's considered a comprehensive evaluation framework. It's out of CDC. If you're interested in that, we'd love to talk to you more about it. But that was the standardized evaluation framework that we settled on at the conclusion of our environmental scan and evaluability assessment.
Okay, So now it's time for an application to your program. We want you to think about the program you identified earlier. And for the sake of timing with this webinar, we're going to assume that you've already gone through steps 1 through 4. And in doing that process, that's how you identified this program that you're going to think about. So we're going to just go ahead and jump ahead to step 5 in the SSA method and have you run through some questions that are going to help you do an evaluability assessment, you know, really quickly of this program that you mentioned in the beginning.
So it looks like those programs that came to y'all's mind, actually, a lot of them have a clearly defined problem. The majority of them have a clear theory or logic model behind it. About the same amount, 59%, have outputs, outcomes, and goals that follow results chain logic. 73%, that's great, have the capacity to provide data for evaluation. The SMART objectives or SMART indicators was a little bit less, with less than 50% meeting that criteria. Some have partially, and 5% they don't do that at all. Does the program have a monitoring system to gather and systemize the evaluation data? 50% say yes, remainder say partially or no. And then, are the likely costs of such data collection and analysis feasible? Majority say yes. And is the context conducive to conduct such evaluation? Majority say yes. The capacities exist to carry it out. Fewer say that there's financial resources available to undertake the evaluation. So it looks like the human capacities may be there, but the financial resources might be fewer.
Lauren, Donna, we have a question that seems very timely as folks, our participants, are working this out in their head. Rick asked, what do you mean by a results chain logic?
Ah, that's a great, you want to take that one, Donna?
So essentially, when we're thinking of that results change logic, we're thinking about kind of that series of if-then questions that you can ask yourself to say, if I do this, then this will happen. If I do this, then this will happen. Just you know, work your way through that if-then series of statements that takes you through the activities leading to the outputs, leading to the short, medium, and long-term outcomes or impact.
Mm-hmm.
So it's that kind of that chain of logic, step to step to step to step.
So if you actually do have a logic model for what the program that you have in mind, it would be that the information in each box of the logic model makes sense. It's logical, for lack of a better word, that you would see the outcomes you expect to based on the information provided, your activities and inputs and resources and such. Mm-hmm. Mm-hmm. Good question.
Thank you.
Other questions? I know that was a complicated checklist to work through so quickly. Mm-hmm. We realize that.
One more question before we move on with the rest of the presentation. Mary asked, how is this different than the theory of change?
The systematic screening and assessment method, or the logic model and theory of change like Donna just spoke of? I
don't know. It just, how is this different from that? The question is, how is this different from the theory of change? Oh, Mary just gave us the answer. The chain of change. How is this different than the chain of change? Thanks, Mary. Appreciate that.
It may not be. I'm not very familiar with, we might call it, we might call it something different than the chain of change, but based on just the language of what that sounds like, it sounds like it's the same thing. It could be.
In evaluation, we have a lot of different terms that are similar, and this sounds like that might be it.
Yeah, that may be very similar to what we're speaking of. So based on this quick evaluability assessment, you should have a sense of areas that need clarification, resource allocation, better direction setting for the program that you had in mind. So the assessment might have confirmed that you have a program of promise or one to share with someone else in your state, to say, yes, there's something good here. Or it might have just confirmed that, yes, I ought to invest some resources into more rigorous evaluation. What we're interested in is what areas did you identify where additional work is needed before more rigorous evaluation or replication begins. So these might be the areas that you now say, going forward with this program, I need to do a little bit more work in this area, whatever area that might be. If you would type those into your question and answer box, that'll at least let us know how you've digested the data, the process that we just went through, how you're making sense of it. So take a minute and tell us about that, what areas you identified.
She thinks your presentation's excellent, by the way, which is always good to hear, but her pen doesn't write fast enough. And Cynthia, we will be posting again a recording of the video, and those will be forwarded to you when they're available. Rick noted that access to resources, again, resources is a common theme coming in here, and technical expertise to implement evaluation process is an obstacle. And those are really two separate things. Certainly resources is an issue across our country, but the evaluation technical expertise can be challenging as well. I appreciate that, the recognition of that. People and finances in place. There it goes again. Julie's chiming in to carry it out. So it's the technical expertise of evaluation specialists and that the money to actually drive the train. Encouraging evaluation as an organizational priority. You're singing to the choir here. A favorable climate for evaluation. Other participants, monitoring systems on the issues. So there are some issues out there still with monitoring systems. There was a request, if you could, Donna and Laura, can you explain a little bit more about monitoring systems? Maybe provide an example or two?
So sure. So here in Mississippi, we're currently going through a program development process, meaning specialists are developing programs that agents will then replicate across the state. And one thing that we have to give thought to is how is data from the county going to get back to the specialists and back to the state, such as pre-post tests. What does that system look like? So antiquated system, but a system we still use, is that there are paper surveys filled out before a program and after a program. Those hard copy surveys are scanned or mailed to the specialist. The specialist input the data into a data set, and then they eventually share it with us to go into a reporting. That's a very elementary monitoring system. There are much more complicated monitoring systems where actually across extension service, there are data entry portals or hubs where you can input your data, whether through an app or from the county office, that more real time gives us the data. So that's what we mean by a monitoring system. There's a system in place, whether it's a process or a physical data processing system that allows us to capture the data we need from the participant to the evaluation specialist or content specialist to better understand how their program's working. I hope that helps some.
Well, and Brenda there's a common theme with Brenda also, who's commenting that she believes that she needs her work teams to all have the same understanding and the process outlined for the evaluation regarding expectations, work, using the same tools. So that gets into data quality and that monitoring.
Absolutely. And so a lot of times what I talk about is evaluation protocol. So essentially you have that step-by-step guidebook that no matter whether you're in County A or County B, you know what you've got to do to get the data collected, the data input, the data cleaned, whatever it is, at whatever level that takes place. You actually have that protocol. You have that guide that says this is the song and dance we're going to follow for this evaluation of this program. And so it's very difficult to invest the time and energy to get that in place for every program we have in extension. So you wouldn't go to that effort for every program in extension. What this systematic screening and assessment method tells us is which programs are ready to invest that energy in. That's the purpose of the systematic and screening and assessment method. So let's say you're an A&R director in your respective state, and you look across all of the programs and you find the ones that have some promise, some evidence that they're achieving their intended outcomes. That's the one you would probably then invest more resources in, that monitoring system, and say, let's take it one step further. We're now going to even more systematically evaluate what we think is going on. So that's just tying it back to the purpose of this overall method that we've been talking about, is which programs are worthy of investing those resources in, human and financial. Donna, do you have anything to add?
Perfect.
Another theme that's emerged from the participant feedback is just that clear connection between program theory and programming components. Alicia commented on that, being sure you have those SMART objectives as indicators. And Rick talked about, which is right along that line, frustration with the inability to evaluate condition changes, and that the big continuum. It's a common obstacle. Rick, you're totally correct here. I think that's, every state would agree with that.
Absolutely.
He has a question for y'all. Do you encourage faculty to focus on behavioral practice change and less emphasis on conditional change?
That's a great question. Let me pull out my crystal ball and see what it tells me for today. You know, we always advocate for at least assessing changes in practices, whether that's behaviors or adoption of a new practice. At a minimum, we need to be collecting that data. There are certain efforts that we have in Extension that lend themselves to condition change or assessing condition change. Some are not there yet. I mean, when we think about economic impact, social impact, environmental impact, we all know we have to be doing that, but very, very few people are doing it well. And it's just on a program by program basis onto whether you can really get that level of assess that level of change. That's why we firmly believe in at least capturing behavioral change, because those programs where you're not seeing behavioral change don't even fool with assessing condition change. You know, it's the ones that you are seeing strong changes in behavior. Then it's like, okay, I want to take it one step further and truly assess the condition change.
Great answer. I've never heard anyone really clarify that point. I've heard that discussed in every setting that I've been in an Extension.
All right, so there were some various lessons that we learned and some ideas that were reinforced throughout this process. First, as we thought, simply conducting an environmental scan through an online survey process was not going to be enough. The follow-up interviews that we did were key to filling in blanks and getting clarification about some of the information that was reported. And then by reviewing some of those existing reports, we could identify additional promising or strong programs that had not been reported through the online survey process. A second lesson was with the email that we sent to our audience inviting them to participate in the environmental scan survey, we included a list of the information that they would be asked to provide. We were hoping that by sending them this information in advance, it would help them be prepared when they actually sat down to do the survey, because it was a pretty intensive survey. And we didn't want them to get frustrated through the process or have to go back and forth and say, oh, well, now I need this, and then have to go back and find it. So we sent them what we were going to ask about early. A third lesson was that essentially the systematic nature of the environmental scan and evaluability assessment processes helped ensure quality in the project. A fourth lesson was that conducting the evaluability assessment, I think as we've already talked about, did also contribute to the development of program theory. By looking at the program information that was submitted through the survey, we were able to find some recurring program planning weaknesses. Again, there were disconnections between objectives, the planned learning activities, and the target outcomes that we noticed in several programs. So in other situations, we might have had objectives or outcomes that did not logically build on one another. So to be better positioned for outcome evaluation and national replication, programs with preliminary evidence or some of those other issues need to give additional attention to basic program planning principles. So we also made recommendations regarding each program's development and some areas that they could improve upon. The final thing was that by identifying those programs that were ready to be evaluated before simply jumping in and doing it, we were hoping that we could help ensure that the limited evaluation resources would ultimately be used in the most appropriate ways when we were able to conduct evaluation. Okay, so as demonstrated through our application, SSA is a clear, straightforward technique. The approach can be tailored to the specific context and resources available for conducting it. But then again, like any evaluation method, SSA has limitations. First, probably most obvious, the list of programs identified through an environmental scan might not be exhaustive. Second, the program information collected through the scan could be incomplete or incorrect. That's why it's important to do the follow-ups. It can be difficult to obtain parallel program information when using different screening methods. And finally, SSA requires a certain level of evaluation expertise that some extension services may lack. So despite these limitations, we still truly believe that SSA can yield meaningful results on emerging programs that are worthy of more rigorous evaluation or replication.
So here's a list of the references that we have used and found helpful in developing our understanding of the systematic screening and assessment method. These might be resources that are helpful for you as well. I'd also like to say that Donna and I had a journal article published in the Journal of Extension last spring, exclusively focused on this method. And what we've discussed today is covered in that journal article. So feel free to pull that just as another resource as you try to wrap your brain around this systematic screening and assessment method. Here's our contact information. We would really like to hear from you if you have questions after today or comments, things you've experienced while trying to decide when the programs in your state are ready for replication or more rigorous evaluation. We welcome you to contact us.